was actually in a different program where I had a couple of issues, and they transferred me to Sovereign. They thought it was a better fit for me. I've been an alcoholic for a number of years, and I've been through a number of programs, and I wanted to make sure that I went to a program that was all-inclusive, which included dealing with my alcoholism as well as any of my past that may have contributed to my alcoholism, and being able to receive therapy from a therapist. Actually, I came from another program, but I had heard a number of very good things about the Sovereign program. It was very different. It was all-inclusive, meaning that I received group therapy with a number of other people who suffered from addiction, as well as a therapist on-site that I saw twice a week, and there was on-site medical, which was very, very beneficial to me because I have a lot of medical issues. But then when we leave the program, we go to a home environment rather than a hospital environment where it's a lot more clinical and it's more like institutional than the Sovereign program. It was very welcoming. I was, like anybody who first, arrives at a program, it's confusing, and you feel a little overwhelmed. But everybody I met was very helpful and very welcoming. So my initial reaction to the program was very positive. I've been in 2 different homes. My first home was Ricardo. It's a beautiful home. The people there were very, very kind and helpful, and I in turn did the same for the people who came into the house after me. We had a different schedule change, so I was moved from a mental health house to a dual diagnosis house because I am dual diagnosis. And the transition was fine because all of the groups I attended were dual diagnosis, so I knew everybody, so it wasn't a horrific transition. And in fact, I really enjoyed it. It's a big house with 11 girls, so the house managers at both homes have been outstanding. I've become very close with them. They're just like family. I love my therapist. I have a czar. She's brought things out of me that I never even knew existed. She's tough, but I needed tough because I've got a very domineering personality, and I really needed somebody to be able to push me, and she's done that, and end result has been very, very positive. I love the trauma group. Usually it's conducted by Carmella, and Carmella is an amazing facilitator. I also like the problem solving and anger management is another really good group. It's real dynamic. And process group, I love process group. We arrive here in the morning, not a whole lot of time, spare time. We get right into group. In the current schedule, we get here at 8 o'clock in the morning. We have 5 groups. All of them are well managed because we're limited on time. We only have 45 minutes in each group. And then there's 15-minute breaks. And we end our day with lunch. And it's here at Sovereign, and it's usually very good food. And then go back to our home and do our chores. Any homework that we need to get done, we have an opportunity to do that. And then, since I am on the dual diagnosis track, we usually attend 4 to 6 meetings a week. I can't say that I have one favorite thing. I love my case manager, Manny. He's helped me through so much. And I said, Azar, I love the people here. I love the energy. When I went, when I was at the mental health house, I liked the quietness when I went home, but I loved coming here because I just like people. I love people, and I love the energy I got from being here at the center. The friends I've made here, the positive atmosphere that was here, and the thoroughness. And I've been here like 73 days, so I've been here a long time. I will probably be here for the full 90, and I'm hoping I am. And I do hope, to be quite frank, I do hope to give my services back in being a house manager here at Sovereign once I leave, so that is something that I've been looking forward to pursuing. This isn't my first rodeo, which I'm sure it's a cliche that's been heard a number of times, but of all of the programs I've been through, I think Sovereign has completed what I've really needed in therapy and in this very challenging disease. And I am hoping, and I feel very positive, that I will not have another, or won't have to have another experience in another program, because I feel like I'm leaving here very complete.